So, how much alcohol is safe for drinking?
So when you aim at your resveratrol dose to improve your, anti-aging and anti-cancer, you're drinking quite a lot of alcohol molecules as well, which would be doing more harm. So needless to say, every drop of alcohol affects your body.
Basically, it's a myth that one glass of red wine is good for you, or one drink off and on is okay for you.
Logically speaking, if you are aiming at resveratrol quantity sufficient enough to improve your health, then you will have to drink gallons of wine.
Namaskar and welcome to another episode of WELCON. As you know, this initiative is for public health, awareness, prevention, cure, you name it. These are the questions that you can put across to our experts that we have on our panel. Today, I have Dr. Harikumar Nair with us. Dr. Nair is currently working as a senior consultant hepatologist. I get tongue-tied with these big words sometimes, at the Liver and Digestive Care Ernakulam Medical Center, Kochi, Kerala. So before I go into a deeper intro of yours, I would like to know something about yourself.
Thank you for inviting me for this program. I have been in liver and digestive care with 24 years of practice. And hepatology, liver, of course, is my passion and focus. Did work as a transplant hepatologist to begin with, and then migrated into hepatic hemodynamics, which is basically liver pressure studies. And currently, I am into community hepatology quite a lot. Primarily because the solution for the problems are all at grassroots level. Community liver care is much more important than anything.
Yeah, I guess that's where we come in, and that's what we have been trying to do, is actually bridge the gap. Like he's saying, it starts from the grassroots level of the community. And we are very grateful to you, sir, for joining us today and sharing your knowledge of nearly 24 years plus. Wow, that's nice. So, sir, we have got specific questions from our viewers, and we collate it, and we would like you to answer a few questions. So, how much alcohol is safe for drinking?
Well, see, this is a very this question I keep hearing from public as well as from in scientific forums as well. Many guideline authorities which bring out guidelines have quoted and stated that X number of standard drinks for women and Y number of standard drinks for men. When you look at these guidelines, we should realize that these are all not healthy drinking limits. These are all limits set for less harming alcohol quantity. So needless to say, every drop of alcohol affects your body. Many people think it is liver that is getting primarily affected. Partly true. In fact, it affects most of the organ systems in the body. The heart is getting involved, the lung is getting involved, kidneys as well get involved, skin as well as hair also gets involved. So answer to your question in just, there is no safe limit, or there's no, scientifically speaking, there is no healthy drinking limit. What you can all do, what you all can aim at, is to have a drinking which is probably less harming or less injury.
So basically, it's a myth that one glass of red wine is good for you, or one drink off and on is okay for you. Is it a myth?
Of course it is.
Okay.
But then this is not a true lie. This is kind of a half truth. I would explain that. Red wine has got many molecules which are good for health. They are collectively known as polyphenols, and a particular molecule called resveratrol is supposed to be very good for health. It has got anti-cancer property, antioxidant properties. But then logically speaking, if you are aiming at resveratrol quantity sufficient enough to improve your health, then you will have to drink gallons of wine. Wine is 14% alcohol, and when you aim at your resveratrol dose to improve your anti-aging and anti-cancer, you're drinking quite a lot of alcohol molecules as well, which would be doing more harm.
So I think the viewers would want to know, or rather it is an important point that Sir has brought up, that yes, there are certain good qualities on it, but the amount that you would need to drink is harmful because it also has alcohol
In it.
content.
If you have a capsule which resveratrol, which the red wine has, of course it's going to improve your health, but then the add-on factor, which is alcohol, is going to harm you. So in nutshell, by drinking wine, you're not going to improve your health. By drinking wine, you're drinking it for the sake of that, for the feeling of, having a drink to relax. That is the purpose. It is not to improve your health.
Okay. I think that is a very important aspect which many of us don't know, the underlying problems that it could cause. Yes, like Sir said, that it's okay to enjoy a drink off and on, but not for drinking it thinking that it's a benefit to the body.
Absolutely.
In any way.
Absolutely.
So, Sir, correlating to this, how does alcohol really affect our liver?
So liver is the factory which deals with many other poisons, as well as what all we ingest or drink as food material or as medicines. Everything has to go through liver, and this factory cleans it up. Once the purpose of a medical molecule is done, then it has to go out of the body. This is done by liver. Similarly, when you drink alcohol, the alcohol molecule goes into the liver, and some enzymes, some chemicals work on the alcohol dehydrogenase, aldehyde dehydrogenase. These are enzymes which act on the alcohol molecule and then chucks it out of the body. In this process, unfortunately, if the quantity and the frequency of alcohol intake is more, then the liver suffers. The liver cells won't cope up, they die out, and some of the liver cells get swollen up. This is called inflammation or alcoholic hepatitis. And when the liver cells die out, scar tissue forms on top of that. This is called fibrosis. And in the long run, let's say 10 or 20 years of drinking, the fibrosis would get added on and ultimately will result in cancer. Liver cirrhosis and liver cancer.
Okay. So, Sir, also many times I've seen, like, suppose someone has had a bypass and they come out and they feel, oh, my heart is as young as, new. And then they forget about what pain or what they suffered.
Right.
And they will drink thinking, oh, the heart is good. But, and specifically if you take a case of a diabetic who's had a bypass and then indulges in drinking, how bad is that?
This would be highly detrimental in the sense someone has ended up in a bypass surgery because his blood vessels in his heart were clogged, and this clogging mechanisms are contributed by metabolic ill health. Of course, alcoholism is also part of it. So he has undergone a major surgery to open up his blood vessels, and going back to drinking would be like inviting the same trouble again. Same problem happens with liver transplant as well.
Okay.
You give a patient a new liver, and now the person thinks that I've got a pristine new liver. I can restart drinking. This is something which the public needs to be aware of. Once a major organ change, a surgeon has done a change in his organ, either replace the organ or doing a plumbing work like in the bypass surgery, which means your lifestyle in the past was wrong. Better that you correct it.
So overall, whether it is liver health or overall health, I think lifestyle is a very important aspect to good health.
Absolutely. If you look at the entire, liver morbidity, a very small percentage happens to be due to genetics. The genetic diseases would be very less. More than 90% is lifestyle disorder.
Oh.
And of course, infections contribute, but beyond infections, it is not at all genetics, it is lifestyle disorder. Whether it be alcoholic fatty liver disease or non-alcoholic fatty liver disease, whereby you eat a lot, but then you don't exercise to a meaningful level and you end up having a lot of fat in your liver. So both these tracks are lifestyle disorder. Big chunk of it is lifestyle, not genetics.
I think many people also, try to get away, or they console themselves saying that it's a genetic issue. But actually, what you're mentioning here is it's majorly a lifestyle issue, not a genetic issue.
Absolutely. That's our ego defense mechanism, right? We want to put the blame on someone else.
Yeah, our mind is very smart.
Yeah, our mind is smart. So put the blame on parents.
Yes.
The ones who gave us the DNA. The genetics.
Very true. So what would be the signs of alcohol-related liver disease that people should look out for?
So this question is very important because you can conceptualize alcoholic liver disease imagine someone is having cirrhosis liver, diagnosed to have cirrhosis liver today. He has been having the damage going on in his liver for last 20 or 30 years.
Oh my God.
He becomes symptomatic, or he gets some problems either in terms of waterlogging, or bringing out blood. His muscles get weak. All those happen only towards the fag end of this entire pathological process, spanning over 30 years. So when that happens, the symptoms are like, either a leg swelling to begin with, or muscle cramps, or sleep disturbance. He may not get a good sleep in the night, but then he feels like dozing off in the daytime. So these are signs and symptoms which should warn that you're having a cirrhosis of liver, but then it's too advanced stage to comment on. The primary damage happening in the silent phase is the time when you can reverse it, but unfortunately there are no symptoms in the silent phase spanning over 20 years. So screening tests are the answer for this. If you could identify in the silent phase, then you can reverse the liver and go back to normalcy. But if you're identifying the disease when you start getting some symptoms like waterlogging, then it's not possible to reverse.
Reverse it. Yeah, because even in our earlier talks that we have had, what we have discovered is that when we actually see the symptoms, it's already too late. You've already got a disease in place.
Yes, yes. The saying would be, to turn yellow is too late.
So my dear friends, you can imagine that you've already abused your body for, say, 2 decades or so before you even come to know that your liver or maybe any other disease that you would have really shows up. I think diabetes is also of a similar kind. It shows up only after 10 years of abuse to the body.
True.